TikTok Deep Dive. Kennedy, measles, and mixed messages. What's really going on? A vaccine endorsement. With a catch. Imagine this. The U.S. Health Secretary finally endorses a life-saving vaccine, but in the same breath, he casts doubt on its safety, suggests unproven treatments, and says he's unaware of massive public health funding cuts under his own watch.
Sounds wild?
That's exactly what happened when Robert F. Kennedy Jr. sat down with CBS News after attending the funeral of an 8-year-old girl who died from measles in Texas. In the middle of a devastating outbreak, Kennedy is sending mixed messages, and the stakes couldn't be higher.
So what did he really say?
What's going on behind the scenes? And what does this mean for the future of measles prevention in America? Let's break it all to funeral, a statement, but still no clarity. People should get the measles vaccine, but the government should not mandate it. RFK Jr. Just days after an 8-year-old girl died from measles in West Texas, Kennedy showed up at her funeral. It was meant to be a solemn moment, a gesture of support. But in a follow-up interview, he made headlines by endorsing the MMR vaccine. Sort of. On paper, that sounds like progress. After months of waffling, Kennedy finally said, "People should get the measles vaccine." But then immediately added, "We don't know the risks of many of these products. They're not safety tested." Wait, what? While the Centers for Disease Control and Prevention, CDC, and World Health Organization, WHO, have affirmed the MMR vaccine is safe and over 97% effective, Kennedy once again played both sides. And public health experts say this is exactly what undermines trust. If the health secretary won't commit to the science, who will? Section 2, the outbreak is exploding, and disinformation is fueling it. Let's look at the numbers. 1. Over 500 cases of measles reported in West Texas alone. 2. 2 confirmed deaths, both young, unvaccinated children. 3. Dozens hospitalized, many of them in critical condition. 4. The virus has now spread to New Mexico, and Oklahoma doctors on the ground are overwhelmed. And infectious disease experts say that Kennedy's messaging is slowing down the response. Instead of clearly telling parents to vaccinate now, he's thrown support behind treatments that aren't even proven to work. Among them, 1. Cod liver oil. 2. Budesonide, a steroid often used for asthma. 3. Clarithromycin, an antibiotic, which doesn't treat viruses at all. There is no known cure for measles, only prevention through vaccination. And pushing these miracle treatments, experts say, gives families false hope and distracts from the real solution. Vaccines work, period. Why is this so hard to say? Cuts, confusion, and a health secretary unfamiliar with the crisis. I didn't know that, and that's something we'll look at. Kennedy on $12 billion in federal cuts. It gets worse. During the CBS interview, Kennedy was asked about recent federal cuts that slashed over $12 billion in funding from programs targeting 1. Infectious disease control. 2. Childhood vaccinations. 3. Mental health services. 4. University research grants, including one for adolescent diabetes. And what did he say? I'm not familiar with those cuts. Wait, what? You're the health secretary, in the middle of a national outbreak. And you're not aware that your administration just defunded the very programs meant to fight outbreaks like this one? Even more shocking, he tried to frame them as mainly DEI cuts, as if equity programs were the only thing affected, completely ignoring the broader damage to public health infrastructure. This isn't just oversight, it's neglect. A deep divide in the vaccine conversation. Kennedy's tepid support of the measles vaccine is being cheered by health officials and slammed by his anti-vax followers. After tweeting that MMR was the most effective way to stop measles, his followers lashed out. Many accused him of selling out to Big Pharma or abandoning the movement. This shows just how deep the divide has become and how dangerous it is when leaders try to play both sides. By trying to appease both science and conspiracy, Kennedy has created confusion instead of clarity. The result? Families are delaying vaccinations. Children are getting sicker. Dangerous treatments are being spread like wildfire on social media. And the outbreak? Still growing. What the experts are saying, loud and clear, Top scientists and health leaders aren't mincing words anymore. Here's what they're saying. This is a tragedy, an absolutely needless death. Dr. Peter Marks, former FDA vaccine chief. These are not medical errors. This sits squarely on the back of anti-vaccine voices. Dr. Michael Osterholm, University of Minnesota epidemiologist. There is no cure for measles. Vaccines are the only way to prevent outbreaks. CDC statement. This isn't about politics. It's about public safety. And while Kennedy may believe he's promoting choice and natural options, public health experts say his approach is costing lives. The time for half-truths is over. When a child dies from a preventable disease in 2025, it's not just a tragedy, it's a failure. A failure of leadership. A failure of communication. A failure of courage to stand up for science. Robert F. Kennedy Jr. had a chance to rise to the moment, to lead with clarity and help stop a growing outbreak. Instead, he gave the country a shrug and a handful of supplements. We can't afford confusion in a health crisis. And we can't afford leaders who treat facts like bargaining chips. If this story shocked you, do this now. Like to support real public health education. Comment your thoughts. Should Kennedy step down? Share this with friends who need to hear the truth. Follow for more deep dives into health, science, and the stories that matter. Stay smart. Stay safe. Stay informed. Measles, outbreak, RFKJR, vaccines save lives, health news, public health, /TikTok, explains, viral truths.